अच्छा जी, तो अब हम देखेंगे मोस्ट इम्पोर्टेंट क्वेश्चंस रिगार्डिंग डिफरेंट कॉम्पिटिटिव एग्जाम्स एंड FCPS और बहुत सारे एग्जाम्स में जो मोस्ट कॉमनली क्वेश्चंस आस्क किए जाते हैं, एंड दैट इज हाई ग्रेड फीवर, स्टेप लेडर, pattern of the fever, rose spot ball, and splenomegaly most commonly occurs in. It is the typical presentation of typhoid fever. Typhoid fever presents with a step ladder preparation of the fever. Step ladder preparation, step ladder pattern of the fever, typhoid fever. उसके अलावा there is the lockjaw rigidity and history of trauma is present in tetanus. Parotid swelling with fever present with the mumps, and the vaccine for mumps, which is MMR vaccine, measles, mumps, rubella, are live vaccine. What other vaccines are live? BCG, OPV, and measles, mumps, rubella, and yellow fever vaccine are live vaccines which will be given to the babies. Parotid swelling is present in mumps. Kaposi sarcoma is HSV8. Most common cause of upper GIT bleeding is peptic ulcer disease. When GIT bleeding, upper GIT bleeding presents with peptic ulcer disease, which is PUD. So this is also important point. The mucus rich gland is sublingual gland. Thyroid enclosed in fascia known as pretracheal fascia. Most common gastric carcinoma is adenocarcinoma, and its lymph node are Virchow node, and system Mary Joseph nodules are also present in gastric carcinoma and adenocarcinoma. Most common hernia is indirect inguinal hernia is most common type of the hernia. Indirect inguinal hernia. Rice water stool is typical presentation of cholera, E. coli caused by cholera, Vibrio cholera, E. coli, and 051787 is the typical antigen rice water cholera. And bull neck appearance occurs in diphtheria. Bull neck appearance and pseudomembrane is present in diphtheria. There are different types of diphtheria of eye, conjunctiva, diphtheria of throat, diphtheria of pericardium. Antibiotics associated with diarrhea is Clostridium difficile. That's associated with the dry diarrhea. And Clostridium difficile mnemonic आप किस तरह से याद करोगे? ABCD, ठीक. C for Clostridium, D for diphtheria, and B for bull neck appearance. and इस तरह से आप इसको याद कर सकते हो mnemonic. उसके अलावा एंटीबायोटिक एसोसिएटेड डायरा, क्लोस्ट्रीडियम डिफिसिल, विरकोज नोड आर फॉर लेफ्ट सुप्राक्लेविकुलर नोड. एंटीडोट फॉर बेंजोडायजेपिन इज फ्लूमिनाजिल. एंटीडोट फॉर कोकेन इज बेंजोडायजेपिन. काजेज ऑफ फिफ्थ डिजीज इज पार्वोवायरस B19. पार्वोवायरस काजेज फिफ्थ डिजीज विच इज स्लेप्ड चीक सिंड्रोम, पार्वोवायरस. और उसके अलावा centripetal distribution is in chickenpox. Varicella zoster vaccine is live attenuated vaccine. Ritter syndrome caused by Staph aureus. उसके अलावा टॉक्सिक शॉक सिंड्रोम caused by exotoxin. Most common cause of acute kidney injury is perirenal failure, acute kidney injury. Most common cause of perirenal acute kidney injury is presence with hairline cast. And ATN is acute tubular necrosis. Presentation is granular muddy brown cast. Acute tubular AIN is acute interstitial nephritis. Is present with the RBC, WBC, and eosinophils cast present there. The pine is tree. And another question is the most common site of GI lymphoma is stomach. Most common site of GI lymphoma, most common adenocarcinoma of stomach is adenocarcinoma most commonly. So these are the most important questions. We will discuss one by one with in-depth review of these questions. Like we will look at typhoid, its clinical features, treatments, and others, all these things. So stay tuned for the next videos. I will be keep on uploading such type of informative videos and the important questions which are asked in multiple exams.